Influenza is very common in India. Roughly around 10 lakh, more than 10 lakh patients get infected with this particular disease in India every year. Mostly it is caused by influenza virus, which again, there are four subtypes of it: A, B, C, and D, of which A and B are the most prevalent subtypes we have in India. And they are the major cause of headache for us doctors in our daily OPDs during the winter season. It is a very, very, very contagious disease. Normally, it spreads very similar to that of COVID 19. What happens is that it can get transmitted from you to me via either airborne route or by handshaking or by exchange of saliva and all those things. Influenza virus is the major causative organism for influenza, not only in India but globally. The two prevalent types that we are concerned about are the influenza type A and influenza type B. These are the two that are mostly found in India as of now. Let's be brutally honest, COVID has taught us a lot, and its signs and symptoms is also very much similar to that of COVID. Normally, what happens, and people can, you as a viewer, you people can correlate with it. Normally, in winter season, what we have got this fever, cough, cold, weakness, dehydration. So these are common signs and symptoms of influenza also. So when we get a patient of influenza, we don't classically term it as an influenza pneumonia. Normally, patient comes to us with a complaint of fever, cough, cold. Occasionally, there might be rashes, and there will be loss of appetite. There will be generalized weakness. All these things are the most major presentation of influenza in India. There are also certain severe types also. I'm not going to details of that as of now, but yes, these are the most common presentations, and it is very much common with what we call as a common cold also. So basically, it is fever, cough, and cold, along with malaise, body aches, that is, and um, dehydration and loss of appetite. The most common one that we do is called a serology test or a culture test. We also have a test called the rapid antigen testing kit where we do it instantly. And the confirmatory test for influenza, what we do is called an RT-PCR, reverse transcriptase polymerase chain reaction test, which is a confirmatory of the which type of influenza this is. Otherwise, rapid antigen test is the most easiest available and readily diagnosed kit we have with us. Treatment of influenza is mostly depends on the severity of the disease. If normally, influenza is a very self-limiting disease. It will not cause you much of a problem. There will be fever for few days of weakness, and it subsides. So what we prefer to give is that a symptomatic treatment. There's no protocol based for this. We just give a symptomatic treatment for influenza. If there is fever, we will give the patient to give antibiotics depending on the severity of the disease. If there is a general malaise, we give at times painkillers to help the patient be a bit comfortable. So treatment basically depends on the symptomatic one. Whatever symptoms the patient have, we treat according to that. There is no specific set of protocol that yes, this is what I have to give. Nothing like that. But all depends on how the patient presents and how severe is the disease. At times when the severity is very high, we ask the patient to get admitted to a hospital and we start the treatment accordingly over there, depending on the severity of the disease. Otherwise, most of the cases are treated on OPD basis and majority of them are symptomatically treated. Ideally, it recovers in 5 to 7 days time. There are patients where we have seen that it has taken more than 2 weeks or roughly 3 weeks for a patient to recover from influenza. But normally, it is a self-limiting disease which goes away in 5 to 7 days time. So a patient will recover within this 7 to 10 days of gap. normally we give it to the elderly people. Ideally, it can be given to the children also, but and the adult population. But in India, what we prefer to do is that we give influenza shots only to the elderly people and not for the younger generation as of now. So what happens for the elderly people, the people above 60 or 65, we give them one shot of influenza vaccine every year. So one shot has to be repeated every year, but there is one problem. The problem is that even after vaccination, the chances of getting influenza is very low, but still we do at times do find cases where patient after getting the influenza shot also still getting infected, but the number is very few. So the present regimen that we have is one shot in one season or in 1 year for elderly population in India. Vaccine is very much effective. Yes, few cases here and there, even after vaccination, might happen, but that should not make us think that the vaccine does not work at all. Vaccine works perfectly fine. At times, people does not produce much of immunity as we want them to. But normally, it is pretty much safe and it is pretty much effective and can be slowly inducted into the national immunization schedule of India also. Influenza can reoccur even after, let's say, you have not got any kind of vaccination and you got infected with influenza this season. Next season also, next winter also, you have the problem. You can get influenza also. There are scenarios where you have seen that a patient got infected twice in the same season. So there is no such given rule that if you're getting infected with influenza, you will not get it either in the same season or maybe throughout your life. It doesn't happen like that. You can get infected with it again, maybe in this particular season or maybe on next season too. So there's no hard and fast rule if you're getting infected once and you are saved for the lifetime, like we have in case of chickenpox. So yes, it can reoccur every year. COVID-19 has taught us a lot. It is similar to that of COVID-19. For influenza, what we need to do is that we need to wash our hands every time we have any kind of meal. We shake hands with someone, make sure you sanitize your hands because you never know who's carrying what. Use of mask is very much advisable when you are in a community or in a marketplace, so that even if you have, you don't transmit to others. If others have, they don't transmit to you. So it is safe for both parties.